What do TB chest X-rays show about treatment response? Imagine you're tracking how well tuberculosis treatment is working, and one of the tools doctors use is a chest X-ray. These images are like a window into the lungs, helping doctors see what's happening inside. When someone is diagnosed with pulmonary tuberculosis, the initial chest X-ray often shows telltale signs like areas of lung consolidation, which look like cloudy patches, or cavities, which are hollow spaces formed by tissue destruction. Sometimes, enlarged lymph nodes or fluid around the lungs, called pleural effusion, are visible too. These features depend on how strong the immune system is and how advanced the disease is. For example, adults with healthy immune systems might show upper lung involvement with cavities, while children or those with weaker immunity may have lymph node swelling or lower lung issues. As treatment begins, doctors usually take follow-up chest X-rays after about 2 months of therapy and again at the end of treatment. The goal is to compare these images to the initial ones. If the treatment is working, the X-ray should show lessening of the lung abnormalities. This means smaller or less dense infiltrates, shrinking or disappearance of cavities, reduced lymph node swelling, and less fluid around the lungs. These changes suggest that the bacteria are being effectively controlled and the lung tissue is healing. But chest X-rays are not perfect. They are mainly visual and somewhat subjective, meaning different doctors might interpret the same image differently. Residual scarring or calcifications can remain even after the infection is gone, and these do not necessarily mean the disease is active. Sometimes, improvements in symptoms or negative sputum tests happen before the X-ray shows clear changes. Conversely, some patients might have worsening X-ray findings despite feeling better, which can be due to immune responses or paradoxical reactions. Researchers are now exploring advanced techniques, like computer analysis of X-ray images, to make these assessments more precise and objective. In everyday practice, doctors use chest X-rays alongside symptoms, sputum tests, and molecular diagnostics to get a full picture of how well the treatment is working. If the X-ray shows persistent or worsening lung abnormalities, it might prompt further tests for drug resistance or other issues. In summary, chest X-rays give valuable clues about the structural changes in the lungs during treatment. They show whether the lung damage is improving, staying stable, or worsening, but they are just one piece of the puzzle. Combining imaging results with lab tests and clinical signs provides the most accurate assessment of treatment response. Always remember, individual cases vary, so it's important to follow your healthcare provider's guidance for personalized care.